Welcome, everyone. This is the Accords Learning Health Systems Seminar Series. This is our culminating event of the semester. I'm very excited to welcome you. If you're not familiar with Accords is the Adult and Child Center for Outcomes Research and Delivery Science here at the University of Colorado. Accords conducts pragmatic research in real-world settings to improve healthcare and outcomes by providing a multidisciplinary collaborative research environment to catalyze innovative and impactful research. We have strong methodological cores and programs, including our education program, led by national experts in their field. We provide consultations in team building for grant proposals, as well as mentorship, training, and support for junior faculty, and extensive educational offerings both locally and nationally, including this series. This year, we had two seminar series, our Learning Health Systems Seminar Series and our Qualitative and Mixed Methods Series. We have one more Qualitative and Mixed Methods seminar coming up next week on reporting and presenting data from qualitative and mixed method studies from Dr. Allison Jari. We are also looking to continue our qualitative and mixed methods research series all of next year. It's been very popular. We know there's a huge demand for qualitative methods, so we're excited to put that together for you. Also coming up later this month is the Colorado Pragmatic Research and Health Conference, or CopperCon. We hope everyone is registered to attend. The theme this year is on disseminating, scaling, and sustaining pragmatic research. We have some absolutely amazing presenters come to teach us about system science, engagement methods, all sorts of biostatistics approaches as it relates to dissemination, scale up, and sustainment of pragmatic research. Today's talk is, like I mentioned, the last in our Learning Health Systems Models and Methods for Embedded Research seminar series. And we, throughout this year, have focused on a variety of different models, mostly United States-based models. We are very, very interested in learning about the Swiss learning health system and a national initiative to support evidence uptake in policy and practice, presented by Dr. Stefan Boes. Dr. Boes is a professor of health economics at the Department of Health Sciences and Medicine and director of the Center for Health Policy and Economics at the University of Lucerne, Switzerland. Professor Boes' research focuses on topics in applied health economics, especially health-related behaviors and decisions, health inequalities, and evidence-informed policymaking, including information infrastructures for learning health systems in the Swiss environment and beyond. Dr. Boes, thank you so much for being here. I'll turn it over to you.
Thank you so much, Bethany, for this very kind introduction. Let me quickly make sure that I'm sharing my screen and that we can all see everything. Here we go. I hope this works well. I'll make this a bit smaller. Here we go. Good. So welcome everybody to this seminar today, and welcome from Switzerland. It's about 8 p.m. here now, and I'm very happy to be with you today talking about the Swiss Learning Health System, a national initiative to support evidence uptake in policy and practice. Bethany already introduced myself, and in my role as professor at the University of Lucerne, I'm also in the lead of the Swiss Learning Health System, which I would like to introduce today in the seminar. What I'm going to talk about is, first, I would like to give you a little bit of background, where we come from. So, I mean, how this initiative actually was initiated at the very beginning. Then I will talk about what the Swiss Learning Health System actually is, where we will talk about this graph that you can see here on the slide, our learning cycle idea. And then I would like to give you some insights on what we achieved over the first 4 years, what we learned also from the start of this initiative in Switzerland, and then give you a glimpse of where we go from here. So we just started last year with the sort of second phase of the project, and I would like to briefly show you what we are going to change based on the initial idea and why we are going to change those things. I think we are a relatively small group, so feel free to also interrupt me at any time. I will also plan some time for the end so that we have a bit of discussion to talk about the Swiss learning health systems and also any comments, questions that you may have, and perhaps I can give you additional insights compared to what I'm talking about in the slides. To get started, just to give you a little bit of a perspective. So what you can see here on the map is Europe. Switzerland is highlighted, and the shaded block is the state of Colorado. So Switzerland is actually relatively small compared to Colorado. Colorado is about 6 times the size of Switzerland. Even though we have a larger population, Switzerland has 8.5 million people. Colorado, as far as I just looked up some numbers, has about 5.7 million inhabitants. So we are a bit more dense in terms of population. From a country perspective, landscape, we also have mountains like you have. So it's perhaps quite similar, Switzerland and Colorado. Also, to give you a bit of background on Switzerland in general, our GDP per capita is about $72,000 in purchasing power parity. We have a federal state system, actually not too different from the US system. In total, we have 26 cantons. That's how they are called here in the States. What is perhaps unique about Switzerland is the type of democracy. We have a semi-direct democracy where citizens actually are actively involved in the policymaking process, not just by elections, but also by actively participating in policy setting. The size of the health system is a bit smaller than in the US, but nevertheless, I think we are like, I mean, apart from US, which probably ranks top in terms of share of GDP, Switzerland is, I don't know, maybe second, third, or fourth, but it's also in the top rankings of all the international statistics. Life expectancy at birth is about 84 years, which is maybe a result of the relatively high performing health system. In general, a relatively healthy population. So overall, I think we are doing quite well. Now, coming to the Swiss learning health system. So what is the Swiss learning health system? First of all, it's an academic network. It's an academic network that spans the entire country. Overall, we have now 11 universities that are involved in the Swiss learning health system. In total, 20 institutes, different institutes or departments, from public health to medicine, to the information sciences, to economics, political science, law, theology, ethics. So a very diverse set of backgrounds, of disciplines that are involved in this network. The Swiss learning health system started in 2017 after about 2 years perhaps of preparation time, where a group of, I would say, very intelligent, creative people came together. And they also asked me to join, and now I'm actually in the lead of this entire thing. Not sure how that came, but now I'm very happy to be part of this initiative. And the original idea of the Swiss learning health system is actually based on these roundtable discussions initiated by the Institute of Medicine in the US on the learning healthcare system, digital infrastructure for the learning health system. So this series of publications that appeared around 10 to 15 years ago. And the idea of the Swiss learning health system is based on that. Our overarching objective is to strengthen the Swiss health system and create a culture of shared decision-making in which sound scientific evidence is continuously integrated into the health system. And the reason why we are doing that is mainly something that we experience as researchers basically every day. Much of the research that we do ends up in publications, in journals, as papers, as tables, as numbers, as graphs. But very often, this research does not end up in policy or practice. And I think this is not a very satisfying situation, not just for researchers, but also for policy and practice. So a lot of good research, a lot of good evidence never ends in the policy making, in practice. And for this reason, we think that we forego a lot of opportunities to improve the health system. And this is actually our motivation for the Swiss Learning Health System. This is what we try to change in Switzerland. This problem in general has been recognized in Switzerland by various institutions, actually not just from research, but from practice. The Federal Office of Public Health is our federal agency responsible for the health system. And they wrote a couple of reports that look into the need for strengthening health services research, for funding of health services research, and that specifically pointed out that there is no coordination of any research activity. So research is done by, a small group of researchers, not really coordinated, and actually none of this research ends up in any policy setting of the Swiss policymakers. There's also no structured network, or there was no structured network. The Swiss Academy of Medical Sciences, which is a bit the equivalent of the Institute of Medicine, followed up with also some reports where they investigated the situation, and they said, biomedical and clinical research is very strong in Switzerland, but health services research with the specific look into translation of evidence into policy and practice is basically inexistent. So what happened afterwards is a very good initiative in terms of funding of research. But what never was part of the discussion of these funding schemes is a knowledge translation infrastructure. So funding went into research. So there was a better coordination and a more structured research initiative than in Switzerland. But still, the research did not end up in policy and practice. And that's where the Swiss Learning Health System comes in, where we actually wanted to make a change in Switzerland. We wanted to, build a cooperation, a network with researchers, but also with policymakers and practitioners to bring evidence into policy and practice. And here's how this works. So what are the mechanisms of the Swiss Learning Health Systems? Well, these are three main pillars. The first one is the bridging mechanism, bridging between research, policy, and practice. And here we follow this cycle that you can see on the slide, and I will explain that in more detail in a second. But basically looking into cyclical mechanisms where we try to identify issues in the Swiss health system, select them for evidence synthesis, and then bring this evidence to the stakeholders via dialogue, agreement, implementation, and then learn from the experiences. And that usually leads to further issues that are identified in the implementation process, further research that is perhaps needed, and again, evidence that is generated that again is played back to stakeholders via dialogues and agreement. And that sort of defines our cyclical mechanisms. As I said, I will explain that in more detail in a second. The second pillar is scientific capacity, making young researchers aware of learning health system mechanisms, making them aware that the research that they are doing is not just for scientific publications. They should do research that also ends up in policy and practice, and make them aware of the mechanisms, how this can be done. And finally, building the appropriate infrastructure on a national scale. So how we can manage health information and make sure that evidence, suitable health information is accessible for stakeholders. That's the third pillar. In my talk, I would like to focus a bit more on the first part, and I will just say a few words, but we can also leave that for the discussion to talk about the other two pillars. So I would like to focus on the bridging mechanism. So generation and selection, evidence synthesis, dialogue and agreement, implementation. This is our idea. So the first step in this cyclical mechanism is to look into those topics, those challenges that we face in the Swiss health system. And we try to facilitate that through different activities, stakeholder engagement activities, consensus building workshops, different sort of network activities where stakeholders, where policymakers, practitioners can come together and talk about the issues that they face in their sort of day-to-day practice. The Swiss Learning Health System then picks up these issues, tries to bring them back to science, to academia, and see, I mean, where in our network do we have the experts to work on that from a scientific perspective? And then actually produce what we call evidence synthesis. So think about the issue at hand and summarize the best evidence that we have from science, from literature, from original research that maybe we do in our network, and put that into a format that is accessible for stakeholders, for policymakers and practitioners. And we call that a policy brief. Overall, we have published now quite many policy briefs over the last years. I think the sort of first funding phase, which was finished in 2020, showed more than 20 policy briefs that we have written in our network. And topics you can see here on the slide, for example, the one that is highlighted in the center, giving patients a voice about cancer care. Should Switzerland do more to collect patients' experiences of cancer care? That's a topic in terms of integrated care solution, patient experiences, patient experience measures that we try to push a bit forward, or that policymakers, practitioners try to push forward in Switzerland. And in the policy brief, we show how this can be done. Okay. Based on the policy brief, we then follow the idea of a stakeholder dialogue. The idea of a stakeholder dialogue is to discuss issues together among the stakeholders to solve the problems in the Swiss health system. How does this look like? Well, a stakeholder dialogue is a structured communication process that uses the format of a deliberative dialogue. In this dialogue, there are multiple stakeholders that come together, and their sort of goal is to work collaboratively to solve the issue at hand. The basis for this dialogue or discussion is the policy brief. And the dialogue follows a certain structure to support this deliberation. First of all, we have sort of very strict enforcement of the Chatham House rules to basically create mutual trust among the participants in the dialogue, create an atmosphere for an open dialogue, and through that, engage our stakeholders. What it also requires, and that's sort of a condition for this dialogue model to work, is a willingness of the participant to actually solve the issue at hand. So the way that the stakeholder participants are selected is usually that, first of all, they face the issue at hand, but they are also willing to actually solve this issue. And then by coming together, entering in this discussion based on the policy brief, we try to support, in terms of a structured moderation, we try to support this deliberation. Now, when you think about the dialogue, I mean, of course, there are different outcomes that are possible. In an ideal world, there are certain agreements that come out of it, signed agreements even, on a certain course of action or an action plan, or maybe a product in terms of how the stakeholders agree how to move forward. Another possible outcome is, of course, also that maybe further research is necessary. Maybe the stakeholders identify that, the suggestions put forward in the policy brief, they all make sense, but still, we face some issues in implementing these suggestions, these recommendations. And in order to solve these questions, maybe we need further research to better understand the situation and the implementation process. And maybe in the worst case, but that's also a possible outcome, there may also be no agreement. But nevertheless, there is a huge value of a dialogue, because even if there is no agreement on the issue at hand and how to best address that, the dialogue still helps the participants to understand why there's no agreement, because they are in the deliberation. So these kind of positions are then put forward in the dialogue, and then we can start working on them. And this is sort of the entire idea of the dialogue, that, even there may not be an agreement on how to best address the issue at hand, there may still be a sort of an exchange of the disagreement, and based on the disagreement, maybe we can find a way forward. If there is a certain agreement on how this works and how we can move forward, then the Swiss Learning Health System also has mechanisms in place to monitor any implementation efforts. So if there are certain recommendations, stakeholders agree on which recommendation is the best one to follow a certain problem at hand, then then maybe follow up with specific steps of implementation. The Swiss Learning Health System follows up with these stakeholders to monitor the implementation process. This helps us to learn from the experiences in the implementation, and also helps us to learn from perhaps some issues that come up during the implementation. This is also something that can occur. And these issues that may come up in the implementation are then perhaps again addressed as part of a next cycle, the learning cycle, in terms of requiring further evidence that is then addressed through a policy brief, a follow-up policy brief, maybe a follow-up dialogue, and then maybe improve the implementation process based on that new evidence that is generated. And in that sense, we really built these continuous cycles where a specific issue is identified, and then the best evidence we have from research, from science, is then continuously integrated to help solve this issue. And this is not a one-way shot. It's not a one cycle event, but it's really something that is continuous. Okay. Of course, what you have to be aware, and what is sort of an immediate lesson learned once you start with learning cycles, is that policymaking is really a very messy process. This involves many different actors, formal, informal actors that are sometimes elected, sometimes unelected. There are different interests in place and relevant for the issue at hand. And there are a lot of sort of obstacles in actually going into an effective implementation. And for this reason, it also takes time. Okay, it takes time in terms of making people aware of the idea of a learning cycle, actually collaborating with scientists, with other stakeholders that may have competing interests, and actually work together towards a common goal. Okay, and I will talk a little bit more about that in the next part, in the achievements that we have obtained so far and the lessons learned from the first 4 years. So first of all, very quickly, what did we achieve over the first 4 years? First of all, we implemented an evidence synthesis platform. So all the policy briefs that we have written over the last 4 years, and it's 20 in total, plus the stakeholder dialogues that we have conducted, information about that is now available through a platform, through our website, an evidence synthesis platform that helps to get information about the issues at hand, about the evidence related to these issues, and what happened based on the policy briefs in the Swiss health system in terms of the stakeholder dialogues, the exchange by different stakeholders, the lessons learned through any engagement activities. This is available through our website. And it's not just available through our website, it's actually used. So we are linking that to other evidence platforms. For example, the McMaster Health Forum also has a similar platform where evidence from issues in the Canadian health system or evidence related to that is shared. And we follow a similar format where evidence or issues and evidence related to these issues in the Swiss health system is shared and can be accessed. Overall, in our network, we have written more than 60 publications on different health system issues. So new research that has been done related to current issues in the Swiss health system. We have established a structured course program related to learning health system knowledge, course program for PhD students, postdocs, senior researchers, where we provide information about the idea of a learning health system and everything related to that, whether it's how to write a policy brief, guidance courses in terms of informing people, what steps to follow in order to write an accessible policy brief, how to conduct a stakeholder dialogue, so to facilitate the moderation, for example. So we specifically train people to be moderators of stakeholder dialogues. In terms of management of health information, so how research evidence can be stored in ways accessible not just for scientific publications, but also to broader sort of machine readable access forms. We established a so-called metadata repository to facilitate research. Health services research in Switzerland was really scattered before the Swiss Learning Health System started. We tried to support the network building, the access to structured data through a metadata repository. And we also created a sustained network across different partner institutions with links to policy and practice. So I think for 4 years, that's quite a substantive list of achievements that we have obtained. And based on that, we are sort of looking into the next 4 years. What we think are the main success factors for these achievements, first of all, is the strong network of partner institutions that are really committed to strengthening the Swiss health system. All of our partners have a common understanding of, first of all, the principles of learning health system, so what the idea of a learning health system is. And they share this methodology of health system strengthening through these learning cycles. We agreed on a set of core values, especially including person-centeredness, inclusiveness, transparency, and accessibility of information. And everything that we do, privacy, adaptability, integrity, quality, and value for all. And based on these values, based on this common understanding of learning cycles, we could sort of achieve these policy briefs, engage stakeholders, and actually move forward based on that. What we also established from the very beginning is a continuous monitoring and evaluation of our mechanisms. So this mechanism of issue identification, writing of policy briefs, quality checks on the policy briefs, stakeholder dialogues and how they are structured and conducted, selection of stakeholders for the dialogue, and then also the implementation process. So we follow all the steps of the SLHS mechanisms. And we think this really helps to keep the quality of everything that we do high. This is also partly reflected by the feedback of the participants from policy and practice. For example, in the stakeholder dialogues, those people that actually access the policy briefs and read them provided feedback on that. That was always very positive throughout all aspects of the learning cycles. So we really think that we are doing something that actually provides a value added, not just for science, but also for policy and practice. What did we learn in the first 4 years? Well, the first thing is the Swiss health system, like many other systems, and especially the US system, I think, is also a highly complex and dynamic health system, which means if you want to follow this idea of a learning health system on all levels, this, needs time. It needs time because people are not aware of this idea of a learning health system. So you need to create awareness. You also need to create interest and advocacy of this idea of a learning health system. And this is not something that happens overnight. So you need people to be involved. You need to show what you're doing, and you need to demonstrate that what you're doing is actually providing a value added to all stakeholders. And like I said, this does not happen over time, and it just needs time. Okay, and I mean, we think that after now 4 years, almost five years that the Swiss Learning Health System is running, we made quite some change, but still, I mean, we are, I would say, at the beginning. So the learning health system idea, I mean, now becomes some momentum, but it will require even more time to be really established in Switzerland. This, I mean, of course, requires also an effort from our side to develop the network of the academic partner institutions, but also the network then to policy and practice. This is especially important because, I mean, we need to create a value added, a benefit for all of them. And especially when you look, for example, into stakeholders, possible stakeholders. I mean, when we think about issues in the health system, if you, I don't know, for example, the quality of healthcare services, if you think about that and how to improve the quality of healthcare services, there are certain stakeholders that are involved, and they will be involved on all kinds of questions related to the quality of care. And if you have many different small issues that you want to tackle, and you have always the same stakeholders that are involved, then first of all, I mean, this is good because, I mean, they are aware of how we can address all these issues. On the other hand, you also create what is called the stakeholder fatigue, which means that, I mean, if you involve them too much, especially if this is in addition to their, I mean, other kind of activities, work that they have to do, they may, I mean, quite quickly become tired of being participants of, say, stakeholder dialogues. So there's always a limit to, I mean, how much you involve stakeholders, and I think it's very important to monitor that. Also, what we realized from the very start when we initiated learning cycles is that there is no one size fits all learning cycle. There are many different issues with very different angles, and in order to address these issues, you need to have project mechanisms, learning cycles that are adaptive to the specific issues at hand and how they can best be addressed. If, for example, you have an issue in, say, I mean, health insurance and how health insurance is selected by by citizens in Switzerland, then, I mean, there are very different angles in terms of how this can be addressed through, I mean, insurance mechanisms, through regulation, through insurance models. Then, for example, when you talk about the provision of inpatient services, optimizing, say, I mean, processes in a hospital. One is really on a national level, where we think about regulatory changes and how to facilitate decision-making for citizens through a suitable regulatory framework. The other is really a matter of practitioners working in a specific hospital setting with all the local specificities of the provider. And the way that you address both of these issues is very different. The stakeholders that you involve are very different, are thinking on very different levels. And you need to have mechanisms in place that are adaptive to, I mean, either or. And that's something that we learned at the very beginning. I mean, the way that you need to address that is not sort of a one-size-fits-all policy brief type or stakeholder format. So that's something that is also important to acknowledge. And then again, sort of, I mean, relating back to the time, I mean, learning cycles, they also, I mean, if you want to implement them, that also requires sufficient time and financial resources. So first of all, identifying an issue is also something that requires time. So sometimes we may be a bit too simplistic in terms of knowing what exactly the problem is. Say, I don't know, certain processes that lead to, I don't know, a low quality, or at least an assessment of low quality of services provision in a hospital setting, but then to really understand what the reasons are for the, I mean, sort of for this break in the patient pathway, in the way that services are delivered, That requires a good understanding from very different perspectives, from the perspective of the patient, from the perspective of health professionals, nurses, physicians, but maybe also from the perspective of, say, the hospital administration, accounting systems, maybe also the reimbursement system. And then that plays back into the legal regulations and the regulatory framework. In order to understand this, I mean, you already need quite some time to pin down what the exact issue is. And then to, sort of prepare the evidence that we have for this issue requires also time. And then to engage stakeholders, again, requires time. So learning cycles are also something that do not happen overnight. And for this reason, you need to, also be a bit patient in terms of getting learning cycles started and running until you actually see some results in terms of improvements in the health services provision. Going from there, what is the idea for the second phase of the Swiss Learning Health System? So right now we were funded for the first 4 years, and we received follow-up funding for a second phase. During this phase, what we already achieved over the sort of last 12, 16, 18 months is expand our academic network. So now we have more academic partner institutions, universities that are involved. Basically, right now, we are, and again, this is owed to the smallness of Switzerland. We have, I think, but 2 universities. We have all universities of Switzerland involved in the academic network. So all of the Swiss academic institutions, universities that we have are involved in the Swiss Learning Health System, except for 2, which we are still in sort of negotiations. And we are very confident that by the end of the second funding phase, we will have a full coverage of all universities in Switzerland, part of the Swiss Learning Health System. What we also try to do is we try to steer a bit the activities within this network, because the network becomes larger and larger. We need to form what we call working groups to work more specifically on the mechanisms of the Swiss Learning Health System, to develop the network, to develop the mechanisms, and to make sure that we are moving forward. The second part is we need to increase our efforts to create awareness, interest, advocacy. For that, we did basically 3 things. One is we engaged in a more structured analysis of the Swiss health system and the stakeholders. So in terms of sort of disentangling the complexity of the Swiss health system, we try to identify possible partners from all actors in the Swiss health system at different levels of governance, different sort of centers of agency, and try to make them, first of all, aware of the Swiss health system, and also try to involve them, either through participation in stakeholder dialogues or through other activities. We also, and that's the sort of, through that, we try to have a better coordination of the engagement of these stakeholders. So especially to address this stakeholder fatigue, we try to make sure that there is no single stakeholder that is overwhelmed by the activities of the Swiss health system, so that it is really like a shared activity among all stakeholders in a reasonable way. The second thing that we did, and that's also addressing the awareness aspect, is we try to focus on certain thematic clusters. So the idea is that we want to focus on certain topics that the Swiss Learning Health System addresses, to make sure that we are really sort of in the sort of monitoring of the agencies, of the stakeholders, that the Swiss Learning Health System provides profound expertise on these topics. And we think that thematic clusters are the right way to go, This, very much relates to the health policy agenda of Switzerland. I will show you that in a second in one of the slides. And the third thing is we, changed a bit our governance structure. The way that the Swiss Learning Health System works, as I said, is an academic network with partners in the health system. And the idea is that we work as a network, we work on different topics, thematic clusters with learning cycles. And the way that we envision or that we establish now the governance structure is that, first of all, we have an academic governing board. So this is composed of our academic partner institutions. We have a management and coordination office that manages all our activities. And then what is new, and that started last year, is what we call a health system advisory board. And in this health system advisory board, we actually involve people from the different actors that you have seen on the previous slide. We involve them as in an active role to be our advisors on the topics that we work on. We also form thematic clusters where the idea is, we have certain topics that we work on, and within these sort of topics, broader topic areas, we initiate learning cycles with policy briefs and stakeholder dialogues. And this is something that we realized, is important to, just be known as experts in that specific field. And where do these thematic clusters come from? Well, we want to address, the current questions of the Swiss health system. So we align that with the Swiss health policy agenda. The Federal Office of Public Health like 2 years ago published the main challenges and objectives and lines of action for the Swiss health system and what the Swiss Federal Office of Public Health is going to address through different activities. And we want to contribute exactly to that. So we have thematic clusters, and sorry, it's perhaps a bit small, but we have thematic clusters, for example, on the quality of care, to safeguard care and funding and financing, healthcare financing. We have topic areas related to health promotion. And we also have, thematic areas, for example, related to the promotion of health literacy and people making better choices related to their health. So this idea of forming thematic clusters on certain topics, health service provision, certain types of care, integrated long-term care, quality of care, new models of services provision and safeguarding the financing. This is something that we see is key to make sure that, first of all, we are responsive to the current issues in the health system, and that we also are sort of known as the experts in this topic area. One way how we then go deep is by running so-called issue building workshops. So the idea is, once we identify these thematic clusters, we want to open what we call calls for joint proposals, where, related to the lines of action of the health policy agenda, we try to address specific issues. And this is done through these calls where we actually then conduct, workshops with stakeholders, consensus building workshops to, first identify issues related to certain topics and prioritize these issues, that we are really addressing the most pressing issues that we have. And just recently, I was in charge of a workshop related to improving the quality of care through integrated care solutions. And for me, that was a great experience because we really brought together stakeholders from all over the health system, from different levels, from the policy level to the practitioner level, from different areas. And we identified the issues that we have in Switzerland related to the implementation of integrated care solutions. Just to give you an example, one of the things that came up is that the idea of integrated care, which is really great in theory, has a big hurdle in Switzerland because of the reimbursement system. Reimbursement is oriented related to inpatient care, the provision of inpatient care, and it's different for inpatient care than outpatient care. And in none of the two reimbursement systems, there is any way of reimbursing integrated care solutions, which means that, integrated care is great in theory, but never ends up in practice because of the lack of reimbursement. And this is now something that we want to address, develop, new innovative reimbursement models that help to foster the implementation of integrated care in Switzerland. And this, issue identification and prioritization was not done by academics, but it was actually done by policymakers and practitioners. And now we pick this up from policy and practice to actually work on that and then bring back new evidence in terms of, novel ideas of reimbursement models that then hopefully will end up in policy and practice at some point. Just to give you an idea. The final thing that I briefly wanted to mention is the digital infrastructure for the Swiss Learning Health System. What we experienced is that, and again, that's an experience that you have as a researcher. Research very often ends up in publications, in journals, and is never really accessible for anybody else than academics that read these scientific journals. And we want to, allow for a better integration through several initiatives in Switzerland that are ongoing, where research evidence should not be accessible just in terms of a scientific publication, so basically numbers and text on paper, but should be accessible in a machine-readable form. And in this way, research evidence can be used, further used, to create new evidence. And this very much follows the idea that also has been put forward by the Michigan group, the knowledge grid, where, biomedical knowledge, knowledge from guidelines that are developed, knowledge from, research in terms of, for example, statistical models, should not be, end up in sort of paper format and then basically dies at some point, but should be accessible in machine-readable form so that it can be further used. And this is something that we now integrate with the idea of our policy briefs, the lessons learned from the policy brief. This is also something that can be translated into machine-readable form, knowledge that can be further used in other contexts. And that's where we are investing right now quite a lot in terms of making this infrastructure accessible in Switzerland. So to quickly summarize, Swiss Learning Health System is a national initiative. It's an academic network that spans the entire country, has a network to policy and practice that also spans the entire country. And what we try to do is bring evidence into policy and practice in a structured way. And the way that this is done is through cyclic mechanisms where issue identification, evidence synthesis leads to stakeholder dialogue, hopefully some form of agreement and implementation, which then further informs additional issues, evidence synthesis, stakeholder dialogue, and through that creates a continuous cycle. What is important in terms of lessons learned so far from Switzerland? You need a strong network of collaborating partners, academic partners, with strong links to the health system in terms of stakeholders. You need an adaptive structure to align what you are doing with the health system needs, in terms of the mechanisms, in terms of the topics that you work on. And you need continuous efforts to create awareness, interest, advocacy for a learning health system. And you have to have a related infrastructure that supports all of that in a seamless way. With that, I would like to thank you for joining this session. And I think we still have some time for discussion. Thank you very much.
Absolutely. Thank you so much, Dr. Boes. That was wonderful. If we were all in the same room together, we would have a round of applause.
Thank you.
We do have a few questions in the chat, and this is a fairly small group. So if anyone wants to ask their question out loud, feel free to take yourself off mute. Maybe you can stop sharing your screen and we can just look at you.
Yes, sure.
All right.
I just lost my. Yeah.
There you are. Wonderful. Okay. So it looks like there are some questions. I'll start at the bottom around kind of the technical infrastructure available in Switzerland regarding, the electronic health record system, and then connections with social service entities and all the different hospitals. Are all of those systems connected from a data perspective? And if not, how do they get integrated? Can you say a little bit more about that?
Yeah, so actually Switzerland is still, at least in my view, is still quite behind in terms of the implementation of e-records. The main issue that we have is that Switzerland, there is a big divide between the inpatient sector and the outpatient sector. And in my view, one of the main reasons why there is a big divide between the two is because of the different reimbursement systems. So we have a DRG system for inpatient services, and we basically have a fee-for-service system in the outpatient sector. And these two sectors are not really integrated. And for this reason, there's also, I would say, maybe a little bit of a lack of interest in collaboration. Why am I saying that? Well, when you think about, or when you look into the electronic documentation systems, then the hospitals actually made quite a lot of effort over the last years to build a system that is compatible between the different hospital types, whether it's acute care clinics, whether it's rehabilitation clinics, or different specialist clinics. But that works relatively well in terms of having a structure that is compatible, because they need to be transparent for the reimbursement system, the DRG system. So this was a requirement of DRG. On the other hand, the outpatient sector with the fee-for-service structure looks very different. Here, there is, very little effort in terms of implementing electronic medical records. And there are certain, physicians actually, it's even on a practice level. Sometimes it's some physician associations or smaller networks that had some activities in terms of finding a system that coordinates their activities, and they have a joint electronic medical record system. But again, this is not really compatible then with the outpatient, with the inpatient sector system. So right now, I think the infrastructure is not well developed, and there are efforts on both ends. One is a national initiative to have electronic medical records standardized across the entire country, and the other is an effort that comes through the reimbursement system. A better linkage between the inpatient and the outpatient sector. I think through these two perspectives, there is something going on to improve the situation. But right now, I think we are way behind in terms of having a good electronic medical record system.
And so how do you sort of evaluate more process-oriented type outcomes, or is that sort of an area of growth?
I think it's an area of growth. I think at least what we have done so far, there are, I think, very good initiatives on the inpatient sector. So when we think about certain activities also in the Swiss Learning Health System, then, for example, one of the topics that we are also working on in the Swiss Learning Health System is readmission rates. That's sort of a concern that in terms of quality of care, that readmissions is something that is undesirable. From the patient perspective, because I don't know, some complications in the process. But of course, it's also, I mean, undesirable for the hospitals because it has consequences on the reimbursement of certain cases. So ways to reduce readmissions in terms of, I don't know, better patient management. That's something that we worked on. And I think there we have sufficient information from the hospital documentation systems that we can really assess, where the issues come from. We can identify the patients that are mostly affected by it. And then we can work on that. Everything related to integrated care, that's sort of the topic that I mentioned before. That's sort of this gray area. That's something that we work on. And here, I think the situation is, I think we need, first of all, better documentation systems in terms of understanding patient flows from inpatient to outpatient, from outpatient to inpatient and then back to outpatient to understand these processes and then improve the quality of them. So I think that's something that we need to work on.
Yeah, such a huge problem. I was hoping maybe you had the answer for all of us, but
no,
thank you so
unfortunately,
much.
I don't.
Well, thank you everyone for attending. Please do our evaluation. Jordan posted the link in the chat, and you'll also get an email with it. So thank you so much, Dr. Boes, for your presentation. And we hope to hear of continued wonderful work coming out of Switzerland.
Great, and I'm looking forward to hear what is going on in Colorado and see whether you are implementing a learning health system maybe there or even on a national scale. Let's see. I know Chuck Friedman is definitely interested in that.
Fantastic.
Yeah, great. Right. So thanks so much for inviting me. It was a pleasure to talk about the Swiss Learning Health System. And for everybody that has some questions, feel free to reach out also after this talk.
Yeah. Thank you. Bye-bye.
Thank you very much. Bye-bye. Have a great day.